When a person has diabetes, either their body does not produce enough insulin or it cannot use the insulin correctly. So glucose accumulates in the blood. High levels of blood glucose can cause a range of symptoms, from exhaustion to heart disease. High blood sugar, hyperglycemia, is associated with diabetes. The Centers for Disease Control and Prevention reports that 13% of U.S. adults live with diabetes and 34.5% have prediabetes. This means close to 50% of all U.S. adults have diabetes or prediabetes. One way to control blood sugar is to eat a healthful diet. Generally, foods and drinks that the body absorbs slowly are best because they do not cause spikes and dips in blood sugar. Signs of diabetes. When undiagnosed or uncontrolled, the effects of diabetes on the body can be noticed by the classic symptoms of diabetes, namely increased thirst, frequent need to urinate, fatigue, blurred vision, and tingling or pain in the hands, feet, or legs. Effects of diabetes on your body. Effect of diabetes on the heart. Diabetes contributes to high blood pressure and is linked with high cholesterol, which significantly increases the risk of heart attacks and cardiovascular disease, diabetes, and strokes. Similar to how diabetes affects the heart, high blood pressure and cholesterol raises the risk of strokes. Effect of diabetes on the kidneys. The kidneys are another organ that is at particular risk of damage as a result of diabetes, and the risk is again increased by poorly controlled diabetes, high blood pressure, and cholesterol. Diabetes and its effect on digestion. Diabetes can affect digestion in a number of ways. If diabetes has caused nerve damage, this can lead to nausea, constipation, or diarrhea. An alternative cause of disturbed digestion can be the result of diabetes medication. Some type 2 diabetes medications, for instance, are prone to causing digestive issues, although these tend to settle down after the body gets used to them. How diabetes affects the skin. Diabetes' effect on the skin is usually a result of its effect on the nerves and circulation, which can lead to dry skin, healing of cuts, burns and wounds, fungal and bacterial infections, and loss of feeling in the foot. People with diabetes are recommended to have their feet checked at least once a year. Diabetes prevention tips for taking control. Lose extra weight. Losing weight reduces the risk of diabetes. People in one large study reduced their risk of developing diabetes by almost 60% after losing approximately 7% of their body weight with changes in exercise and diet. The American Diabetes Association recommends that people with prediabetes lose at least 7% to 10% of their body weight to prevent disease progression. More weight loss will translate into even greater benefits. Set a weight loss goal based on your current body weight. Talk to your doctor about reasonable short-term goals and expectations, such as losing 1 to 2 pounds a week. Here are some foods to lower blood sugar levels naturally. Leafy greens. Leafy green vegetables are extremely nutritious and low in calories. They're also very low in digestible carbs, or carbs absorbed by the body, so they won't significantly affect blood sugar levels. Spinach, kale, and other leafy greens are good sources of many vitamins and minerals, including vitamin C. Some evidence suggests that people with diabetes have lower vitamin C levels than people without diabetes, and they may have greater vitamin C requirements. Vitamin C acts as a potent antioxidant and also has anti-inflammatory qualities. Increasing dietary intake of vitamin C-rich foods can help people with diabetes increase their serum vitamin C levels while reducing inflammation and cellular damage. Avocados. Avocados have less than 1 gram of sugar, few carbohydrates, a high fiber content, and healthy fats, so you don't have to worry about them raising your blood sugar levels. Avocado consumption is also associated with improved overall diet quality and significantly lower body weight and body mass index (BMI). This makes avocados an ideal snack for people with diabetes, especially since obesity increases the chances of developing diabetes. Avocados may have properties specific to preventing diabetes. A 2019 study in mice found that avocado B, a fat molecule found only in avocados, inhibits incomplete oxidation in skeletal muscle than the pancreas, which reduces insulin resistance. More research is needed in humans to establish the connection between avocados and diabetes prevention. Eggs. Regular egg consumption may reduce your heart disease risk in several ways. Eggs may decrease inflammation, improve insulin sensitivity, increase your HDL, good cholesterol levels, and modify the size and shape of your LDL, bad cholesterol. A 2019 study found that eating a high-fat, low-carb breakfast of eggs could help people with diabetes manage blood sugar levels throughout the day. Older research has linked egg consumption with heart disease in people with diabetes. But a more recent review of controlled studies found that eating 6 to 12 eggs per week as part of a nutritious diet did not increase heart disease risk factors in people with diabetes. What's more, some research suggests that eating eggs may reduce the risk of stroke. Beans. Beans are affordable, nutritious, and super healthy. Beans are a type of legume rich in B vitamins, beneficial minerals, calcium, potassium, and magnesium, and fiber. They also have a very low glycemic index, which is important for managing diabetes. Beans may also help prevent diabetes. In a study involving more than 3,000 participants at high risk of cardiovascular disease, those who had a higher consumption of legumes had a reduced chance of developing type 2 diabetes. Broccoli. Broccoli is one of the most nutritious vegetables around. A half cup of cooked broccoli contains only 27 calories and 3 grams of digestible carbs, along with important nutrients like vitamin C and magnesium. Broccoli may also help manage your blood sugar levels. One study found that consuming broccoli sprouts led to a reduction in blood glucose in people with diabetes. People with diabetes may also need to take medications and measure their blood sugar regularly to reduce the risk of potentially dangerous symptoms and complications. Speak with a doctor about how to incorporate a healthful diet into a diabetes care plan.